Hello, I'm Hannah. I'm going to be your physical therapist today. We're going to do a few tests on your shoulder. I'm going to have you lay on your back. The first test that we're going to do is the apprehension test. What this tests for is possible labral tears or anterior instability. So I'm going to bring your arm up to 90 degrees, abduct it, and then passively externally rotate, so push your arm back. And if there's apprehension or pain, that test would be positive. But since there is none, it's not positive. Another test we're going to do, if that test was positive, is the relocation test, which is the same thing, Job's relocation test. And the only difference is that I'm going to push the humeral head down to relocate it and see if that will decrease the pain or apprehension. And if it does decrease that pain or apprehension, that means the Job's relocation test is positive, which also tests for anterior instability. Now we're going to do a drop arm test, which tests for full thickness rotator cuff tears. So I'm going to abduct your arm to almost full range, and then what I'm going to have you do is slowly lower your arm, okay? So slowly lower it. And if the arm were to drop, then it would suggest a supraspinatus tear. I wash my hands. Hi Bonnie, my name is Hannah. I'm going to be your physical therapist today.
Hi Hannah.
How are you doing?
I'm okay, got a little pain.
Okay. Alright, so we're going to do some tests to see if you have any sacroiliac dysfunction, okay?
Perfect.
So these tests are going to be done while you're laying on your back, so that's good. You're in the right position. If you could put your legs down for me. Perfect. So is it okay if I palpate or if I touch your hips?
Sure.
Okay, so I'm just going to palpate your ASISs. Alright, so right here. And first we're going to do something called a distraction. So I'm just going to press in right here and squeeze, and let me know if that reproduces pain. Any pain there?
Nope, feels good.
Alright, awesome. So that was the distraction. If there was pain, then the test would be positive. So now we're going to do the compression test, which is going to be the opposite. So I'm just going to cross my arms and find those ASISs again and push outward this time. So let me know if there's any pain. Any pain?
Nope.
Alright. And then that would have been positive if there was pain. Both tests for sacroiliac joint dysfunction. What we're going to do is assess your hip mobility, hip capsular mobility, okay?
Okay.
I'm going to start with doing a posterior glide, which would increase flexion and internal rotation. I'm going to put this towel on your leg. And now I'm going to lift your leg up into about 30 degrees of abduction and flexion. And I'm going to put my hand up on top of your thigh. Is that okay?
Yes.
Okay. So now I'm going to, on the femoral head, push down, an anterior to posterior glide, which will assess the posterior capsule. Okay, so now if you could flip over. Alright, now I'm going to put this on here and we're going to do something called an anterior glide, which is going to increase extension and external rotation. This time, I'm actually going to have you scoot a little bit closer towards me. This way. Yep, there you go. And now I'm going to relax your leg. There you go. I'm going to make sure I'm holding not on your patella, just up a little bit above. And I'm going to put my hand right underneath your bum. Is that okay?
Mm-hmm.
Okay, so right in here. And then I'm going to do a posterior to anterior glide. Okay.